about the human body. It gets harder for every question. Duet and blind react. Where in the body can you find the Achilles tendon? In the heel, what is the medical term for white blood cells? Leukocytes. Which organs contain the highest percentage of water? The brain and kidneys. What is the name of the pigment that colors our skin? Melanin. The alpha cells of the pancreas secrete which hormone? Glucagon. What is the average lifespan of red blood cells? 120 days. Which organ stores vitamin K? The liver. What is the name of the two first cervical vertebrae? Atlas and axis. And last question, which nerve innervates the trapezius muscle? Spinal accessory nerve. Quiz about the human body. It gets harder for every question. Duet and blind react. What is the biggest joint in our body? The knee joint. What is the primary energy carrier of our cells? ATP. The two female hormones are estrogen and progesterone. What is it called when a fertilized egg implants itself outside of the uterus? An ectopic pregnancy. What is the six-pack muscle called? Rectus abdominis. What is the second layer of our skin called? Dermis. Which disease is commonly known as lockjaw? Tetanus. What is the name of the muscles causing goosebumps? Erector pili. And last question. Takotsubo syndrome is more commonly known as what? Broken heart syndrome. Quiz about the human body. It gets harder for every question. Duet and blind react. Where in the body can you find the patella? In the knee. Approximately how much blood does an adult's body have? Around 5 liters. Which is our largest nerve? The sciatic nerve. What are you afraid of if you have acrophobia? A fear of heights. Where in the body can you find the scaphoid bone? In our wrist. How many bones do we have in our wrist? 8. Which organ primarily destroys red blood cells? The spleen. What does parosmia mean? A distorted sense of smell. Which hormone is often referred to as the love hormone? Oxytocin. And last question, what is it called when blood circulation spontaneously returns after CPR has been stopped? Lazarus syndrome. Quiz about the human body. It gets harder for every question. Duet and blind react. What does hypotension mean? Low blood pressure. Which blood type is generally referred to as a universal donor? O negative. What is it called when you lack healthy red blood cells? Anemia. What is the outer ear made up of? Cartilage. Which is our longest muscle? The sartorius. Where in the body can you find the navicular bone? In the foot. What does it mean to be ambidextrous? To be equally right and left-handed. Which disease is also known as marble bone disease? Osteopetrosis. And last question, sialadenitis is the inflammation of what? Salivary glands. Quiz about the human body. It gets harder for every question. Duet and blind react. Where in the body can you find the tibia and fibula? The lower leg. Which lung is bigger, the right or the left? The right. Nails are primarily made of what? Keratin. If you have celiac disease, what can't you eat? Gluten. On which organ can you find the islets of Langerhans? The pancreas. What does emesis mean? Vomiting. How many bones do we have in each foot and ankle? 26. How many cervical vertebrae do we have? 7. And last question, which cervical vertebrae is referred to as a vertebral prominence? The 7th. Quiz about the human body. It gets harder for every question. Duet and blind react. What does anosmia mean? Lack of smell. What organ stores bile? The gallbladder. What's the medical term for white blood cells? Leukocytes. What hormone raises blood sugar? Glucagon. What is the principal muscle of respiration? The diaphragm. What tube transports urine from the kidney to the bladder? The ureters. What's the most common sexually transmitted disease worldwide? HPV. What are you afraid of if you have trypanophobia? A fear of needles. Where in the body can you find the pip joint? In the finger, the proximal interphalangeal joint. And last question, what cranial nerve controls sensation of the face? The fifth one, trigeminal nerve. Quiz about the human body. It gets harder for every question. Do wet and blind react? What is the name of the system in our body that transports blood? Cardiovascular system. Which hormone plays a role in our sleep cycle? Melatonin. Which is the largest joint in our body? The knee joint. Odynophagia means pain during what? Swallowing. Which of these hormones is produced by the testes? Testosterone. Which area in the brain is involved in speech? Broca's area. When you have Addison's disease, which hormone are you deficient in? Cortisol. A positive Brudzinski sign is an indication of what? Meningitis. And last question. What does unicornuate uterus mean? Only half the uterus develops. Quiz about the human body. It gets harder for every question. Do wet and blind react. What is it called when a cell divides into two identical daughter cells? Mitosis. Which cells in our body are the longest? Nerve cells. Which sense is controlled by the olfactory nerve? Smell. What does it mean when cancer has metastasized? It means it's spread. The hepatic artery supplies which organ with blood? The liver. What does dyspepsia mean? Indigestion. Phlebitis is the inflammation of what? A vein. What is the first branch of the aortic arch? The brachiocephalic artery. Where in the body can you find epiploic appendages? On the large intestine. And last question, which nerve runs on top of the psoas muscle? The genitofemoral. Quiz about the human body. It gets harder for every question. Do wet and blind react. What is the most abundant cell type in our body? Red blood cells. What does emesis mean? Vomiting. Which chemical is released in huge amounts when you work out? Endorphins. Conjunctivitis is more commonly known as what? Pink eye. Which organ produces bile? The liver. The deficiency of which vitamin can cause scurvy? Vitamin C. Which protein is the most abundant in our blood? Albumin. What are you born with if you have polydactyly? Extra fingers or toes. On which bone can you find the cribriform plate? The ethmoid bone. And last question. Meckel's diverticulum is a remnant of what? The vitello-intestinal duct. Quiz about the human body. It gets harder for every question. Do wet and blind react. What is the name of our biggest artery? The aorta. The small intestine is divided into how many parts? 3. What connects bone to bone? Ligaments. What's the active substance in EpiPens? Epinephrine or adrenaline. Where is adrenaline produced? The adrenal glands. What's the most common form of eczema? Atopic dermatitis. What transports urine from the kidneys to the bladder? The ureters. Which vitamin plays a key role in blood clotting? Vitamin K. And last question. Superior rectal, sigmoid, and left colic are all branches of which artery? The inferior mesenteric. Quiz about the human body. It gets harder for every question. Do wet and blind react. What is it called where two bones meet? A joint, which is our largest internal organ. The liver. The renal arteries supply blood to which organs? The kidneys. Which gland sits on top of our kidneys? The adrenal glands. Which bone is not connected to any other bone? The hyoid bone. What is the primary muscle of respiration? Diaphragm. Which agent decreases surface tension in our lungs? Surfactant. On which bone can you find the coronoid fossa? The humerus. Where in the body can you get a Smith's fracture? In your wrist. And last question. Bordetella pertussis causes which disease? Whooping cough. Quiz about the human body. It gets harder for every question. Duet and blind react. Which part of the cell generates energy? The mitochondria. What connects muscles to bone? Tendons. What are the bones in our ears called? Ossicles. How many ossicles do we have? 3 in each ear. What does polyuria mean? Excessive urination. What kind of joint is the ankle joint? A hinge joint. People with Hashimoto's disease have a problem with which organ? The thyroid gland. Where in the body can you normally find Sertoli cells? In the testicle. A positive colon sign is bruising and edema around which structure? The umbilicus. And last question. A choriocarcinoma is the cancer of which organ? The uterus. Quiz about the human body. It gets harder for every question. Duet and blind react. Myocarditis is the inflammation of which organ? The heart. Which part of our cell contains the DNA? The nucleus. If you have hypernatremia, what do you have an excess of? Sodium. What do you have if you have nephrolithiasis? Kidney stones. What kind of stimulus is detected by nociceptors? Pain stimulus. Pernicious anemia is caused by the lack of what? Vitamin B12. Which clotting factor do you lack in von Willebrand disease? Von Willebrand factor. In which condition do we use the rifle classification? An acute kidney injury. And last question. Which organ is affected if you have a coloboma? The eye. Quiz about the human body. It gets harder for every question. Duet and blind react. How many bones are there in each of these fingers? 3. What is the most common cancer worldwide? Breast cancer. What is this bone called? The clavicle. Which organ is removed during a cholecystectomy? The gallbladder. On which bone can you find the coracoid process? The scapula. Typhoid fever is caused by which bacterium? Salmonella typhi. A positive Goldflem sign indicates a problem with which organ? Your kidneys. Which of the abdominal muscles is the most superficial? The external oblique. And last question, which ligament is also known as the Popart's ligament? The inguinal ligament. Quiz about the human body. It gets harder for every question. Duet and blind react. What color does venous blood have? Red. What are you afraid of if you have hemophobia? Blood. Splenomegaly is the enlargement of which organ? The spleen. How many bones do we have in our wrists when we're born? 0. If you have thrombocytosis, do you have too many or too few platelets? Too many. People with von Willebrand disease have a problem with what? Clotting. What is measured using an orchidometer? Testicular volume. Where in the body can you get a Jardiway fracture? In the nose and the nasal septum. And last question, which syndrome is known as trisomy 18? Edwards syndrome.